All right. Hello, healthcare professionals. I hope you had that webinar and found it incredibly insightful. I'm Ben, your moderator for this event, and I'm thrilled to be here with you. Now, in case you missed it, as we transition to the Q&A session, let me take a moment to introduce our distinguished guest, Dr. Baran Erdik. He's not just an expert, he's a dedicated educator in the ever-changing realm of healthcare regulations. Dr. Erdik brings a wealth of knowledge with a specialization in areas such as stringent policy compliance, deeply rooted in both federal and state regulations, as well as enhancing operational efficiency within healthcare systems. So, without further ado, I encourage you to seize this opportunity. Feel free to ask any questions you have so that Dr. Erdik can provide valuable insights and guidance. Let's make the most of this interactive session together. Over to you, Dr. Erdik.
Hi, Ben. Great to be here. Thank you for having me. As always, it's a pleasure. I've been working with Hygia, and I only have good things to say, and I look forward to everyone's questions.
Awesome. Well, everybody, don't be shy. Your questions are crucial. Please feel free to raise your hand or type any queries in the chat. Dr. Erdik is ready to tackle them head on.
Yes, I mean, there's been lots of changes, even as recently as a week or two ago that the CMS is starting to drop the hammer on the accrediting organizations. So things are moving at warp speed, just like they did for the SARS-CoV-2 vaccines after the public health emergency ended last year. So
Awesome. Well, I'm seeing that we're getting a question from the audience right now. How can providers navigate the transition from fee-for-service models and ensure financial stability?
Fee-for-service has been dying. If you're not transitioning already, or if you haven't started the transition, you're in for a slow burn. The lawmakers or the legislature has been trying to cut down on physician fee factors and conversion rates and all of that good stuff. And ultimately, if you haven't started it, there's no way you're going to be financially sustainable for fee-for-service. That's one. Two, beyond that, your goal becomes providing quality. How you do that, depending on what your specialty is, if you're a bigger facility, if you're a single provider facility, just a private health clinic somewhere, it'll depend. And TLDR, it'll go through quality. And the way you achieve it, you have to be on top of providing evidence-based medicine, but it's not just providing it per se, it is also documenting it in a way that CMS wants to see or other payers wants to see. And with things like that, if you need a roadmap, if you have any questions, we at IG are here.
Awesome. All right. Well, whether it's about recent regulatory changes or specific challenges you're facing, now is the time to ask your questions about healthcare compliance. Oh, I see we're getting another question from the audience in. Can you elaborate on any new requirements related to patient consent and how providers should handle patient information in compliance with regulatory regulations?
There isn't necessarily any major changes with regards to consent per se, but there is changes with regards to information blocking, right? U.S. government ideally had hailed October of 2022 as Data Liberation Day, meaning the limitations on the scope of EHR information had been lifted. And under the 21st Century Cures Act, now every healthcare provider, hospital, EHR vendor, information exchange, information network, etc., they're all subject to ONC, and ONC is the National Coordinator for Health Information. So they have to comply. And then ultimately, if you're a physician, you're interfering access, exchange, or use of electronic health information, you are considered an information blocker. And A, there is this incentive. B, if you're doing it sort of, I don't want to necessarily say on purpose, but if you're a non-compliant actor, let's say, then you may be subject to civil monetary penalties. There are some exceptions, but TLDR, again, at the end of the day, data is, it's not yours. It's not even the patient's. It's the big data. It's the US's. It's the world. So it has to be shared, right? We need to have good data to do good studies to provide good evidence-based medicine.
Would you mind telling me a little bit more about the patient side of things, like how that impacts the patients?
From a patient perspective, the changes have been that, 10, 20, 30 years ago, you got a lab test and you had to wait for the doctor to see it, maybe get a copy from the doctor. Then we moved on to faxing, which unfortunately we still use to an extent, and currently the patient is privy to all their data. And from a patient perspective, that's a good thing and a bad thing. The good thing is there's no blocking, so the patient doesn't have to necessarily go chase their data, lab values, orders, this or that. It's very easy for them to change providers, or it's very easy for them to shop around for procedures, right? But on the other hand, then I don't know. I'm sure there's some data, but it may also be causing undue or unnecessary panic on a patient. Imagine you get your lab work. I don't know, you're mildly anemic. There's nothing to it, but it's a Friday, then you're going to be like, why is this lab value that? Why is this lab value this? So there's two sides to the medallion. But at the end of the day, the rule is the rule, and sort of the patient owns the data. So the physicians need to be more careful documenting interactions with patients, maybe use less, I don't want to say biased, but less pointy language, more neutral language, just knowing that all of this data may be read by the patient.
Great. We're getting other questions from the audience here. Are there any changes for reimbursement for 2024 as it pertains to internal medicine groups?
That's a too broad of a question, right? Ultimately, I don't know if you're a ACO, I don't know if you're with a hospital group, I don't know if you're an individual provider. I'm gonna slowly start from the bottom up and I guess work my way up. Ultimately, the Medicare physician fee schedule, if you're just talking about Medicare, Medicaid, right? The conversion factor change and it's low, and then there's about a 3% decrease from the 2023 conversion factor. So again, if you're just providing fee for service, it's dying. There's maybe some good news. If you're in internal medicine, family physicians, something like that, you can do an add-on for many of the E&M services you do. So the G2211. And then you also have the telehealth flexibilities that are extended. So basically, there's a carrot and a stick approach. The stick is if you do nothing, if you're just billing fee for service, you're going to lose money. The carrot is, if you do telehealth, if you do the new add-on code describing the visit complexity, then there's a lot of opportunities for you to get on the bandwagon and make more money.
Well, during this brief pause as we await more questions from our viewers, Dr. Erdik, I'd like to extend my congratulations on the launch of your course at Healthcare Mastery Academy. It's an amazing opportunity for professionals to embark on a journey of developing their practice. Your expertise is not only shared here in this session today, but now reaches an even broader audience through this educational initiative. So let me ask, who did you have in mind when designing this course, and who do you believe will find it particularly beneficial?
I think everyone in healthcare, maybe not even in healthcare. I am a naturally curious person. I like learning things. Like currently, I've been doing different classes, and I hope to get a master's in continental philosophy, right? So it's the same thing. This is sort of a beginning class if you're sort of interested in the state of healthcare in the US in 21st century, alongside the regulations. If you're a layperson, if you're interested, yes. But if you're a healthcare provider, it's also sort of, I think, your wake-up call that things are changing and you need to get on with it. You can't expect to, unfortunately, practice medicine in the US like you did in the late 1990s, early 2000s. Things are changing really, really fast. Maybe the COVID public health emergency gave way to compliance in some people because nothing was being enforced, nothing was being really pushed, but we are back at it 120%. So in short, I would say anyone in healthcare or anyone interested in the status of the US healthcare in 2024.
Great. Yeah, for those listening, I really cannot recommend this course enough. It is fantastic, and you can find it right on the Hygia website. A reminder to everybody, the floor is open for your questions on healthcare compliance, so feel free to share your thoughts or seek clarification from Dr. Erdik while he's here. All right, seeing another question come through. Dr. Erdik, if our practice is primarily primary care, are we better off in value-based model or fee-for-service?
Again, there is no one-size-fits-all. Let's do, I guess, a couple hypothetical scenarios, right? I mean, if you are in a rich zip code where a lot of people are privately insured, I honestly would not necessarily bother with a belly-based model unless they're healthy, and I'm going to do capitation. That may be a good way of doing it.
Mm,
Uh, but on the other hand, if you're in a relatively older area, maybe suburb, maybe a little bit poorer, then a fee for then value-based model may be a much better fit than fee for service, because especially if there's a lot of chronic diseases where you can get ahead of the disease process, like diabetes, hypertension, and do a lot of preventative, cheap, and show the value, then that would be a good model. But I think the first step is to know your patient population and then tackle up a plan. And if you're struggling with any sort of that aspect and modeling, again, we are here to help.
mm. Another question from the audience. My practice doesn't have the financial resources to continuously tap on attorneys. How can we track with all the evolving changes?
So if you're a single provider, right, there aren't necessarily that many regulations depending on the state. Ultimately, we can't and we don't regulate the practice of medicine. I mean, who am I to say that XYZ drug, why did you do this? We don't nitpick. If you're a bigger practice, there's more regulations on you, and the more you go into the hospital, etc., more regulations there become. So ultimately, the simplest way is to sign up for CMS newsletters, maybe follow up on the changes that get posted on the Federal Register, and then the rule making. But that's dry. If you're not interested in that, we also are planning to provide a newsletter and updates at Hygia that are more in a digestible format and a digestible language. So that may be a way. But beyond that, before you even look at all the evolving changes, I think you need to sit down and create a list of what changes may possibly affect you, right? Like, if you're a single provider, do you really need to remember that CMS has started to crack down on accrediting organization performance? Probably not. Do you need to track changes with regards to MIPS? Yes, you do.
Hmm. Is there anything in the world of healthcare regulation going into 2024 that has been missed commonly in the past over and over and over again that you've experienced, that may have shifted a little bit or looks completely different now than it did last year?
I mean, not necessarily, but it's I don't know how people are not fed up, right? It's the same conversation we have every year. They try to lower the physician fee factor, then there's a bunch of arguments. Then the American Academy of Physicians or the family practitioners, this or that, goes against it. Then they come back to it. But the same thing can unfortunately be, it's the issue beyond the control of a single provider.
Mm,
Uh, because of how the legislator is working. It's just the way currently how budgets are made, how laws are passed, have become asinine because of different factors in the. I don't want to get political, but so it ties back to that, and ultimately. From a provider perspective, I think we can't just keep doing the same thing and expecting different results annually.
mm,
So I don't have an answer of what to do, but I can tell you what we are doing is not working.
sure. Sure, that makes a lot of sense. Again, I wanna tap on the audience and say if you have anything that you want to ask Dr. Erdik while he's here, now is a fantastic time to ask him. I can't think of anyone more qualified to talk on this subject than him. All right. Again, I also want to point you back to the Hygia website. The Healthcare Mastery Academy is a great resource. We're very lucky that Dr. Erdik was able to do a course with us. On the topic of the course, was there anything that you focused on in the course that you think could be directly applicable to this conversation today?
I mean, a lot of it, right? The course is not to necessarily make you an expert. The course is to get you to understand what's going on, what you need to focus on, and how it affects you or how it will affect you. Ultimately, I mean, the fee for services model is dying because why? I don't even have to explain the why, right? All I have to show you is the OECD data. We are losing life expectancy by 2030 if this goes on we are gonna be below any developed nation, all the while we're spending the most amount of money. So why? Is there inefficiency? Are we not able to get to the patients? There's a lot of things, but the way it's been decided to tackle this is to change fee for service first and see where that gets us. So whether you agree with it or not, that's what's happening. So unfortunately, you need to get on the bandwagon.
Awesome. Do we have any more questions from the audience right now? I want to point you to ask Dr. Erdik any burning questions that you may have. Anything? All right. Not seeing any new ones coming in right now. I want to say, well, Dr. Erdik, what can you tell us about healthcare regulation overall? Like, what's something that people feel should change that has not seen a change yet? Like, what may be coming up in the future?
I mean, there's pull and push, right? In an ideal setting, you gotta want to see what the patients want to see, what the providers want to see, what the nurses want to see, and what the facilities want to see.
Mm.
Ultimately, what it becomes is that there's differing agencies and different what they want to do, right? So I mean, ultimately, I'll leave it with that. So a patient may want to see a nurse constantly attend to them, or like, oh, give them the sandwich, give them. That's not feasible from a monetary perspective. Facility may want to cut down on nurse numbers. That's also not good for patient rights. And the nurses may want minimum staffing numbers, which some states have done, like California, and I think is coming around. So that's going to be good. But from a rule or regulation perspective, I think I urge people to first understand how this goes on, or how laws are made or regulations are made. And then if you feel strongly about it, there's usually in the federal rulemaking process a way for you to comment. Because ultimately, if again, without discussing any parties or something, unless a party holds a super majority of the Senate seats, they are not necessarily legislating. They're not allowed to. So the way we do laws, like no one in their right mind would design it this way, but it's been this way because ultimately you are basically legislating through the budget reconciliation. So if there's a strong voice like the American Academy of Family Practitioners, or I don't know, ACEP, American Academy of Emergency Physicians, their voice gets heard and there's some sort of bill gets tacked into that budget reconciliation and it's passed. Beyond that, there is just not really a push, or there's just too much other noise going on to really focus on healthcare regulations per se. And the major change we had was the Affordable Care Act, and we are going to live with it for the foreseeable future. But what I can tell you is that, in my opinion, that's been attacked and attacked and attacked and attacked, but it stayed strong, so it is here to stay.
Earlier, we had a question about how changes in reimbursement for 2024 are affecting internal medicine groups. Is that affecting things like hospitals in a different way?
Hospitals, it does and it doesn't. So for hospitals, there's no single source of income, right? There's a bunch of different things. So for hospitals, there's a lot of different changes going on. For example, one of the main issues has been ER overcrowding, and as a response to that, and as worried as everyone was for the SARS-CoV-2 pandemic, there was the hospital at home waivers launched. So they are going to be expiring at the end of this year, and nothing's been done really about them. So there's a lot of unknowns for hospitals, and then there's been changes about the different, like the 340B drug pricing program, this or that. So for hospital, the answer is not simple, but most of the different ad hoc programs they may be using via CMS are under constant changes, are under constant attacks. And ultimately, CMS is just trying to make sure they save the taxpayer money. They're not doing it out of their bad will. There just is a lot of overhead, and it's not necessarily a priority. And instead of discussing on these, there's a lot of different political issues going on.
Great. Well, unfortunately, it looks like our time is coming to an end. Thank you so much, Dr. Erdik, for sharing your insights and expertise today. For those of you who still have questions or are interested in personalized guidance on these topics and more, you can head over to the Hygieia website and click on the tab titled Talk to an Expert. There, you can schedule a free 30-minute call to define your needs and have an expert analyze your case. To keep up with us as well, you can follow us on LinkedIn. Check out our website. There's a lot of great information on there. If you've just joined us or happen to miss today's program, you can visit the website to register for an upcoming webinar and Q&A session. Another way to stay connected. Thank you. We look forward to seeing you again next week.